I'm going to talk about a tongue thrust appliance or a thumb sucking appliance. They're very similar. This young lady, Tilly, is an 8-year-old little girl, and if we have a look at her photograph, you can see that she has an open bite. Her top and bottom teeth don't meet. The side teeth, as you can see, are edge to edge. The top should come down over the bottom, but it doesn't. In addition, you can actually see that she is constantly pushing her tongue between the top and the bottom teeth. And this doesn't allow the jaw to develop correctly. Her tongue is keeping that space open. And when her tongue is in there, then she's sucking her thumb at night. So it's her thumb that's keeping it open. We've given her an appliance which has some metal loops in it. They're loops, they're not sharp, they don't hurt, but they prevent her from sucking her thumb, and they also prevent her tongue from coming up and protruding or keeping the top and bottom teeth separate. To create this appliance, we took some study models. If I open this, you can see the palate, and we make an appliance to go across the palate, hug these teeth up to the front with loops that protrude just behind the front teeth. This is the labial bar that sits across the teeth, lining up these laterals, which may want to protrude a little bit. These little ball clasps hold the appliance in position. This photograph shows you these loops that I was discussing. So the plate goes across the back of her mouth, like so. There are clasps around the teeth holding it on, and it sits comfortably in there. She wears it day and night, 24/7, other than to brush her teeth. This little screw here is activated. It's a fan-shaped appliance. So when that screw is activated, and it's turned one turn every 5 days, the fan opens in this fashion. The back teeth are meeting reasonably well, but these forward teeth have been drawn in and aren't meeting the bottom teeth in the correct fashion. If we have a look at Tilly 2.5 months later, we can see what tremendous improvement there has been. Tilly is still wearing her appliance. The treatment is not complete. The plan is to bring these top teeth down about 2 or 3 millimeters over the bottom teeth and expand the appliance so that these teeth on either side at the top come down over the bottom. When you look at this, you can actually see that the teeth are slanting in. That's not ideal. We want the teeth to sit nice and vertically, which is comfortable, appropriate, and the occlusal plane should be in a flat plane coming across the mouth parallel to the ground. What we're doing is we're preparing Tilly for braces at about the age of 12 or 13.